Planet Vero Studio is powered by the Nolan Group of eXp Realty.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
Good afternoon and welcome to Community Conversations. It's that holiday time of year. Those of you that see me on Facebook know I'm in red because it's that month where all those Christmas parties start to happen and we start bringing in our little potluck bowls to celebrate with our coworkers and maybe even exchange gifts. But it occurs to me that it's also a time of year where we're trying to take our ordinary income and stretch that a little bit further so that we can not only share in food and friendship, but also give some small token or gift. But those tend to add up, particularly for those of us with big families. And so the natural thing is to figure out where can we skimp a little bit for that particular time period. Maybe make a payment late or not buy something that we normally would at all. And unfortunately, often what falls by the wayside, gets deferred or even totally eliminated for a month are our medications because they tend to be very expensive. Most people understand that Treasure Coast Community Health has a sliding fee scale so that they can come in and talk to their providers, their doctors, their dentists. We take not only a sliding fee scale for low-income people, but we also set up payment arrangements for those who maybe are not deemed low income, but have a high copay or some other means that would otherwise act as a barrier to care. But nobody thinks about doing that for pharmacies. It's sort of like once they're out of the pharmacy, they're yours, and therefore the payment responsibility has to happen at that transaction. And so I asked Jalecia Chambers, one of our pharmacy techs, and a real expert on one of our federally qualified health benefits about pharmacies today and what kinds of things can be done and why people should not be thinking about deferring their medication pickups. So welcome, Jalecia.
Hello.
Not the first time you've been with us. You have in the past talked to us about patient assistance programs for very expensive medications that may or may not even be covered if you have insurance. What types of medications do you help people with that we see as sort of very expensive?
So one of the main ones are our diabetic medications, whether they be insulin or sometimes even some of the pills that are taken by diabetics can be a bit expensive. Also blood thinners. There's some blood thinners that are actually a part of patient assistance that are pretty pricey.
Yeah, they're very convenient compared to the old days of Coumadin where you had to pick your finger every day or every other day. You had to watch, I can't have too much spinach or other green vegetables. Coumadin's fairly inexpensive, but it has all those detriments to taking it. And things like Eliquis are now the wonder drug because you just pop 1 or 2 a day and you don't have to be tested. But I notice the commercials never talk about the cost. So you're telling us those are pretty pricey.
Yes, Eliquis being a popular one is a big one that we at Treasure Coast actually do a lot of patient assistance for, as well as things like asthma medications, those inhalers that treat asthma, bronchitis, things like that. Those are pretty pricey as well, and they all have patient assistance applications available for them.
And once they do a patient assistance application, do they have to renew that periodically, quarterly, yearly? How does that work?
It does depend on the manufacturer. From what I've personally seen, most of them are 12 months.
Okay.
They last 12 months, and then around about that 11th month, we do like our patients to start gathering your documents together so that it will be a seamless renewal and you don't have to have a gap in care.
And are those applications difficult to fill out?
They're not difficult to fill out, but if there are patients that do have challenges of filling them out, we at the pharmacy, we help with that. We provide the application.
Okay.
They are applications that anybody can print offline themselves, but we do assist with that if we have patients that, maybe not have computers at home or things like that, or need help filling them out. We do all that for them.
So if someone wasn't sure if their medication was expensive enough to qualify for patient assistance, would you be able to help them if they came up to the window and said, my doctor's ordered this, I've heard it's expensive, can you help me with it?
So all brand medications, so there's brand and then there's generic. After so long, a brand will bring out a generic drug. So anything that's a brand name drug, they have patient assistance available for them. It's all brands.
Okay.
Yep.
So not to worry, just ask and you guys will help them.
Yes. And even if you as the patient don't know if that's the brand name of the drug, we'll know.
Okay. Yeah, you caught me a bunch of times. I know that one. Okay. So that covers a lot of those newer, more expensive, probably still under patent brand name drugs. What about the more common ones that are for chronic diseases? Juvenile arthritis, for example, I understand is a pretty expensive way to go.
So for those, we look on the manufacturer's website. Even if we in the pharmacy don't know offhand, we can. It's a quick Google search. We'll look up the medication. A lot of times, even when there's no patient assistance for, say, uninsured patients, there's usually always a copay assistance for patients who do have insurance, but the copay might be a little bit out of reach. There's usually always some kind of card that we would print out for the patient that will give them a discount on their copay for upwards of 12 months at a time.
Now, some folks have said, oh, well, I don't need to talk with you guys about medications because I use GoodRx. Is that a fair statement, that they don't need to talk to us because GoodRx covers them about as well?
That's not a true statement, because
I'm putting you on the spot here. This is an honest conversation.
Yes. So with GoodRx, it is a good tool when you're going to, say, a Publix or a Walgreens or a CVS. So what we at Treasure Coast Community Health Pharmacies have done is, although we don't take that coupon, we will price match for you. So if you came and said, oh, well, I can get it cheaper at CVS because they take GoodRx, we will look at that GoodRx coupon and we will match that price. That way, we don't want you to leave the doctor, have to go wait in line at CVS when you can just give us 5 minutes of your time and get your medication right there.
And again, that's what Treasure Coast Community Health's goal has been, to offer accessible, high-quality, comprehensive care so that you're not running around from spot to spot.
Right.
And then that automatically has already been a part of their medical record. So from that perspective, it doesn't matter to us where they get it filled. The whole idea is to get it filled.
Right.
Okay. So removing barriers to that, you all started doing home deliveries not that long ago.
Yes, we actually started during COVID. That really was a big help to a lot of patients who were, scared to come out to the pharmacy or just can't make it. We have some patients who are just homebound, or, they only have enough time to go to see the doctor and then they have to leave, but they want their medication.
Okay.
So we do deliver. We'll bring their medication right to them. If sometimes we'll mail it out to them, but whatever, it's the patient's preference, whatever they decide.
And so that applies whether you have insurance, you don't have insurance. Is it only for Indian River County residents?
It is not. It is for every Treasure Coast Community Health patient, no matter if you live in Vero Beach, Fellsmere, Port St. Lucie, Melbourne, wherever you come from.
That is awesome. That is really, really something. We're going to have to take a short break for a word from our sponsors, and then we'll come back and we'll talk about some of the patients that you've helped. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH Pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Affordable Water continues to offer you the best water on the Treasure Coast. Earn a competitive salary and a 401k, working weekdays as a delivery driver or water treatment tech. To apply, stop in at Affordable Water in Sebastian at 645 Old Dixie Highway.
Right now at Sunshine Furniture, it's holiday sale time. They are clearing out their warehouses to make room for new furniture styles, and this means you can save on selected styles from Lloyd Flanders, Beechcraft, Windward, Riverside, Universal, Caprice, Four Seasons, and more. Sofas, dining sets, patio groups, occasional chairs, cabinets, bedroom sets, and occasional tables. There are lots of pieces on sale from inside and out, just in time to make Santa say ho ho ho. Sunshine Furniture has the largest selection of coastal furniture anywhere, including a gallery of Tommy Bahama Home and a Universal Coastal Living collections. Visit Sunshine Furniture now for their holiday sale. And right now, all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in Vero Beach. Online at sunshinefurniturecasual.com. And don't forget to shop their outlet and sell store just across the street.
Sunshine Furniture.
Hi, this is Julie Lilliquist. From all of us at Evergreen Media and Planet Vero, thank you for your support in the last year. We wish you a wonderful holiday season and a joyful new year.
And welcome back to Community Conversations. My name is Vicki Soule. I'm the CEO of Treasure Coast Community Health. And I come each week bringing guests that will help to educate and inform and sometimes even amuse those of you that are out there in our community. We know we have a number of visitors at this time of year. We also have folks that have decided after visiting what a wonderful place it would be to live and have moved here. And so we hope that you will tune in every week, Saturday at 4:30 to this station. And you'll be amazed at the variety of folks that come forward and tell us about things that you might want to know a little bit more about. So today we're talking with one of our own staff, Jalecia Chambers, who's a certified pharmacy tech and a bachelor's degree in business. And so she helps us quite a bit in terms of our pharmaceutical audits and really helping patients at the front areas to understand more about the insurances, the options, the things that we can do to remove those barriers to care. We originally started our pharmacies about 8 years ago because we heard over and over again that people had not gotten their medications due to some barriers, whether it was cost, transportation, nothing close, couldn't trust being able to get it at the time that was convenient and so forth. And so we opened up our pharmacy in Fellsmere, and then when we opened up Oslo, we put a second one there. And most recently, we opened a third one in the center of Indian River County at the Gifford Health Center. So we're very happy to be able to provide that service. But more than happy about it, it does add to both the benefits for patients as well as benefits for our company. So, Jalecia, from a patient perspective, what do you see as the benefits to being a Treasure Coast Community Health patient and using our pharmacy? Because it is not open to everyone, only our patients.
Correct. So the main benefit, I would say, is the discount our patients receive. You could go somewhere else and may pay $50 for a medication, and when you can come to us and pay $5, we are afforded the benefit of receiving a discount through a program, the FQHC program, the 340B, that it allows us to get our medications in stock at a lower cost, so we can in turn give it out back to our patients at a lower cost. That's the best thing about it. Everyone likes to save a penny here and there.
Well, it really adds up if you have a repeating medication.
Right.
I know for many, many years we were fortunate that Publix offered all the antibiotics, or virtually all of them, at no cost, because that's what you all call pennies medication, right? It cost pennies to purchase them, and so they would literally give them away free as a goodwill gesture. But that practice has stopped. Is that correct?
That is correct. As of July of this year, Publix no longer offers any free medication because along with those antibiotics, they had a few blood pressure medicines and things of that nature that they also offered at free of charge. So once they stopped that, we at Treasure Coast Community Health Pharmacy kept our free list going. Okay. We feel it's not cool, quote, so to speak, to start something and people get used to getting something for free for years or whether months, and then it just stops. Right. So we still have our free list that actually has a little more than even what Publix was offering on it.
Okay. And so, again, if you're new to town, maybe you visited last year and depended on Publix for that, know that Treasure Coast Community Health is still available. We do require that you see a physician or a nurse practitioner. That's a statewide law. Yes. No matter how much you cry or beg, that we used to see you, and so just refill it. There's a ruling about a 1-year visit.
Correct. So you have to see your physician, your primary care physician, at least once every 365 days. Okay. So once a year, essentially. Okay.
And so the state of Florida also has something that I wasn't familiar with until recently, and that is, I think they call it e-scripts, where all the pharmacies submit to the state database so that physicians can see what the patient's maybe gotten from someplace else.
Okay, so that's actually called eForce.
Ah, okay.
So that is what happens. So as a prescription is filled, it's for the controlled medications.
Okay.
So anything that's a controlled substance that is filled at any pharmacy, it goes to this eForce database to where you can, and each pharmacist is supposed to check eForce every time they're about to fill a controlled substance to make sure a patient isn't, doctor shopping or even pharmacy shopping, things of that nature, because unfortunately stuff like that does happen. So that system, yes, is called eForce, and every pharmacist has access to it. Every physician should have access to it as well, but that's not a part of their job description, to check that. But as an extra caution, it would be nice if they did, because they can kind of stop it at the door. But if it does sneak through, the pharmacy does catch it.
Okay. And that's very important because obviously the whole role of pharmacists and pharmacy techs is to keep an individual safe, even sometimes from themselves. And so when you talk about checking medications, you also do checks against other medications that might have counter reactions. So can you describe that a little bit?
So luckily, a lot of the systems where pharmacies process their prescriptions through have different barriers or different barriers that will pop up. So if I went to go fill a prescription for a patient and in their chart it shows where they have an allergy to an ingredient in that medication, the system won't even let me proceed before I get word either from the physician or from the patient stating, oh, it's okay, it's just something that happened when I was younger, or something like that. And then there's codes you put in that will override that. But it also does that for drug interactions. If a patient is taking a certain medication and then a provider sends something that might interact with that, that same type of warning or pop-up pops up to caution before continuing to fill that, to where, oh, you might want to talk to the patient, you might want to talk to the provider, you know, and then you have to get codes and all that. So it's very safe. These pharmacy systems have a lot of safeguards that help with things like that.
But I point that out because while I'm familiar enough with it, because I get to hear behind the scenes at times, I also hear patients that say, what in the world is holding this up? My doctor wrote this. Why won't they fill it?
Yes.
Okay. It could be one of those safeguards.
It could be. Yes, ma'am.
Okay. Because that is then your job, to follow back to the individual who wrote the prescription and have that discussion with them.
Right.
You can't just automatically change it to a different med.
No, you cannot. However, there are some drugs that are interchangeable, but it wouldn't be for a situation like an allergy or a drug interaction. It would be maybe more so with the insurance. Oh, we won't cover this one, but we'll cover this one. And they're interchangeable.
And that they do exactly the same thing.
They do exactly
Just
the
two
same
different
thing.
manufacturers,
Same ingredients,
perhaps?
yes.
Okay.
But as far as a drug interaction, it cannot just be changed. You always have to reach out to the provider and let them know, on this patient's profile, it says XYZ. And then that's when the pharmacist will step in and say, well, they shouldn't be taking this with this, but they can take this with this, and they're in the same class. That's when they have that conversation, you know, amongst the professionals.
And that's not really a rare occurrence, is it, with all the different medications that are out there these days?
It's, yeah, and with all the new stuff that's coming out, it's kind of, it happens more than we would like.
Yeah. That's my sense as well.
Yes.
So thank you for sharing that, because we aim to be quick and efficient, but we also have to measure that with the safety factor.
Right. And I love the fact that we're in the clinic with the providers, because if we were off-site, we would only have the option of phone calls. Us being in the clinic, it's nothing for our pharmacist to hightail it down the hallway, talk to the provider real quick, and come on back. It just kind of streamlines or fast paces the process. And
so oftentimes when individuals will be asked, do you have any questions about these meds? 90% of the time, I'll bet it's no.
Yes, it's either no or how do I take it?
Okay. Well, I said we would talk about some patients, and that brings me to thinking of the patient that you all recently had, who was foreign born, didn't have a real good grasp on English, and had medications that needed to be taken differently, morning, afternoon, and evening. And how did you resolve that?
So, unfortunately, the patient also couldn't read even in their native language. So what we did, we used pictures. Everyone knows what a sun looks like. Everyone knows what the moon looks like. And for afternoon, we did pizza. Everyone knows what pizza looks like. So we just did pictures on the different medications. We separated it all for them. And that's how they stayed compliant. We made sure we did home visits to say, hey, do you need more medication? We would check on it for him and go from there.
That's wonderful. And that's just the tip of the iceberg in terms of the personalized care that I've seen you all do for our patients. And so if you don't yet have a primary care provider, or if you are looking to perhaps have some counseling, but in the past you've been assisted with medication, give us a call, 257-8224. And thank you, Jalecia, for being with us today.
Thank you.